well in. The Breast Health Global Initiative is moving forward in a 5-year implementation plan. And there are 3 components of this that we will be talking about further. Implementation science, or outcomes research. This is the study of how we implement. And we began this discussion in the last Global Summit in Budapest. We may know what to do, but that does not make it happen. And indeed, making something happen is a science in and of itself. Studying when I do an intervention, did my outcome achieve what I had intended, that is actually a major focus. It's wonderful to go do good work, but if you don't measure your outcome, you will not be able to prove to anyone that you actually made a difference. And so this study is a key issue. Scaling up, we're going to be talking about that during this conference. You may have a model that could work well within a certain hospital or facility, but when you scale it up to the population level, you may lose fidelity. You may lose consistency within that. That's also something that we need to study. Education and training is the second leg of the stool. It's something that everyone here is involved in. We recognize that providing training and education is critical to what we do, knowledge transfer. We also have to recognize that knowledge transfer goes in 2 directions. So those of us from the United States may have a fair amount of familiarity with how to treat breast cancer in the context of the tools that we have available. We may know fairly little about how to do this in a setting like India, like Ghana, where they don't have all of the tools, but nonetheless, they are able to move forward. So it is a mutual training opportunity. Technology, application, and development, there's some level of technology that's mandatory, particularly in imaging and pathology. Now, the way that we're putting this together in this implementation strategy is the development of learning laboratories. This is my friend Riccardo Massetti came up with this idea, the recognition that we all come to learn together, whether we're coming from a high-resource country or a lower middle-resource country. So by creating partnerships with in-country organizations, the Breast Health Global Initiative is starting these implementation projects, the first of which was in Ghana, and we'll hear more about that later today. So the last point that I would like to make, because I believe this is going to be an ongoing theme throughout this conference and really a key concept in what we do. We have been in the prior global summits, we've been focused on the medical side of what we do, that how to do early detection, diagnosis, and treatment in the setting of limited resources. We really would be terribly naive to think that that ended the story, because there is a public side to this. There's the community, the women, who must be active participants in this process. Unlike the movie Field of Dreams, we can build it, but that does not mean they will come. And so what we actually have to do is, through our treatment, create survivors, because survivors can carry the message through advocacy groups, through communication groups, in outreach, to bring women together to say, you know what, you can do this, this can be done. And those groups are the ones that communicate best to the public, the general public, to raise awareness. And this whole issue of awareness, getting women to understand why we do what we do and why they should participate so that they are empowered to participate in early detection, that may be one of the greatest demands that we have to address to decrease breast cancer mortality at a global level. And so we have to think in this broad fashion as we go.